In this presentation, we will use the MiniLift200 sit-to-stand lift for a car extraction. The MiniLift is a uniquely and ergonomically designed battery-powered mobile sit-to-stand lift that helps patients go from a seated to a standing position. Patients must be able to bear weight to transfer using the MiniLift. Patients should also be able to follow simple instructions and be non-combative. For safe and trouble-free operation of the MiniLift, please refer to the user manual for the safety inspection. Open the car door and assess the patient's condition to make sure that the patient does have some partial weight-bearing ability. Place the correct size thorax sling behind the patient and buckle the safety strap around the patient and pull it snug. Use the side handles on the thorax sling to help turn the patient so that their legs are outside the car door. Move the MiniLift to the patient in the car and help them place their legs correctly on the footplate. Adjust the depth and height of the shin plate to properly fit the patient. Remember, the recommended height for the shin pad is just below the patient's kneecaps. Tighten both the height and depth settings for the shin plate by turning the screw knobs to the right. Now, adjust the ergo arm of the MiniLift. Simply lift the knob on the ergo arm and pull the handle out to make it easier to attach the thorax sling loops. Attach the loops of the thorax sling to the ergo arm one at a time, making sure to use the same loop height on each side. Pull the pin of the ergo arm up and pull the ergo arm away from the patient to remove any slack between the thorax straps and the connection points on the ergo arm. When you have removed the slack from the sling, let go of the knob on the ergo arm to lock the position into place. If the patient has an unusable or weak arm, place the arm in the corresponding strap located on each side of the thorax sling. Make sure the brakes are not locked and instruct the patient that they will now be lifted. Press the up arrow button on the MiniLift hand control to raise the patient so that their buttocks clears the seat, and make sure that their head does not hit the top of the car on their way up. Once the patient is raised, carefully pull them away and turn them over to a wheelchair placed next to the car. Press the leg widening button on the MiniLift hand control to widen the legs as you place the patient's buttocks over the seat of the wheelchair. Once the patient is sufficiently over the seat of the wheelchair, press the down arrow button for the ergo arm and slowly lower the patient into the wheelchair. If needed, use the handle on the side of the thorax sling to help place the patient properly in the wheelchair. Now that the patient is safely in the wheelchair, pull up on the knob located in the middle of the ergo arm and pull the ergo arm out. This will make it easier to remove the thorax sling straps. Remove the straps connected to the ergo arm and pull the MiniLift away from the patient. Now remove the thorax sling. Taking the time to remember these simple procedures will pay off in years of safe and comfortable lifting for you and those you care for. If you have any questions or comments, please consult your local distributor or system robotics specialist.